Hi, I'm Dr. David Hill, and today we're going to be talking about how to relieve nasal congestion in infants. Now, there are a variety of reasons that infants can get a stuffy nose. The most common, of course, is viral infections, colds. A cold is likely to last no more than 7 to 10 days. It will go through a phase of having green mucus as well as phases of clear mucus at the beginning and at the end, and that's still a cold. If it goes more than 10 days, or if there's a fever that lasts more than 3 days or goes away for more than 24 hours and then returns, you start to think about a bacterial sinus infection, and for that, you should speak with your baby's doctor. Likewise, if there's prolonged runny nose that doesn't seem to come with other cold symptoms, your baby certainly could have allergic rhinitis, especially if your infant is approaching 1 year of age. We tend to see it more after 6 months of age. This may respond to antihistamine medications, which your baby's doctor may prescribe. The biggest problem with congestion is that babies really need to be able to breathe through their noses when they eat and when they sleep. They're obligate nose breathers, we say. So what are you going to do about that? Well, the initial treatment is to get a little bit of saltwater nose drops. Now, you can run out to the store and buy a brand like Little Noses, for example, but you can also make these at home. All you need is a level ½ teaspoon of salt and 1 cup of fresh water, clean water, of course. You want to take that and heat it up so that the salt dissolves, and then let it cool down. You certainly don't want to burn your baby's nose, so let it cool back down to at least body temperature. Then take a little dropper and just dribble 2 or 3 drops in each side of the nose. Then you need that suction bulb. Hopefully you still have it from when you came home with your newborn. Otherwise, you can buy one at the drugstore for $2 or $3. They're made of rubber, and they're usually bright red or light blue in color, although they could be any other color as well. Those are the most common, though. And you're going to go back and suck that stuff right back out of your baby's nose. Key thing about direction: the passages actually go straight back, not up. So you want to kind of point it straight toward the back of the head when you go in. You don't have to jam it way down in the nose. You can just leave it right there at the opening of the nose, and it'll work just fine. Another note: don't overdo it. You don't have to do this every time your baby turns around, just before feeds and before bedtime. If you go in there too much, you can actually cause more swelling and congestion. Now, I haven't mentioned the possibility of gastroesophageal reflux, but sometimes babies don't spit up a whole lot with their reflux, but they do keep a chronically congested nose and a chronic cough. So if your baby has these symptoms, especially for weeks at a time, and they're not getting any better, do talk to your doctor about the possibility of reflux, because there are several very effective interventions we can make, both medicines and non-medical interventions, to help out with that. Talking about dealing with a baby's congested nose, I'm Dr. David Hill.